Good morning, members of the public and media friends. Welcome to the 11 a.m. Press briefing. Today, besides the Chief Executive, we have the Acting Secretary for Home Affairs as well. In a moment, the Chief Executive and the Secretary will give a speech and then we will take your question. Because of the epidemic, please keep your mask on and maintain social distancing. Now, Chief Executive, please. Good morning, friends, media friends and members of the public. This morning, together with the Acting Secretary for Home Affairs, I will report to you the work that we will begin soon. That is the distribution of anti-epidemic packets to all families in Hong Kong, which I mentioned earlier on. Since the beginning of this wave, we have been aware that it is of utmost importance to ensure the supplies to Hong Kong, especially medical supplies. That's in line with the request that I have made with the central governments in February. Medical supplies is one of the aspects that we need help from the central governments. The central government is acceding to all our requests. Every day, the Secretary for Economic Development and Commerce, which is responsible for leading the task force, has been issuing a press release every day to update you on the medical supplies and the distribution of medical supplies received from the mainland. Now, we have done the following. First, medical supplies are distributed to frontline staff members, including civil servants as well as those staff members with a high exposure risks. They would receive the medical supplies, including PPE as well as RAT kits. In terms of the distribution of RAT kits, for high-risk volunteers, every day we are distributing 2 million kits to them. They include security guards, cleaners, as well as those working in residential care homes for the elderly and people with disability, as well as volunteers who help us distribute supplies to the public. Second, RTD, or restriction and testing declarations. We have carried out some 2,000 RTD operations. Some 370,000 members of the public were subject to compulsory testing. Food supplies as well as medical supplies were handed out, including RAT kits as well as Chinese proprietary medicine. Third, in respect of the high number of confirmed patients as well as their household members, we are offering them support at home. The first contact point is the delivery of the anti-epidemic supplies package. Since the second half of February, the Innovation and Technology Bureau has distributed more than 1 million bags of anti-epidemic supplies to some 460,000 infected patients, as well as some 520,000 close contacts. We have caught up with the backlogs. Like I said a few days ago, we have already cleared the backlog. On the second day of confirmation, we are able to deliver the anti-epidemic packets to the patients. And also, when we identify risky areas from sewage samples, the HAB, or the Home Affairs departments, would distribute RAT kits to the neighborhood. Now, the government has distributed some 5 million RAT kits to infected neighborhoods. And also through our anti-epidemic alliance, we have distributed another 5 million. In total, 10 million RAT kits were distributed through in this manner. Now, like I said, on the premises that we have adequate medical supplies, we will begin to distribute the supply kits in a more regular and organized manner. The 3 million families in Hong Kong will be given the anti-epidemic packets. The first purpose is to enhance the awareness of members of the public. The goodie bags would include the anti-epidemic pamphlets or tips to guard against the virus. Now, with the supply bags, we encourage members of the public to make use of the RAT kits in the bag so that we can identify cases as early as possible and arrange for isolation and quarantine. And also patients can receive a triage and treatment as soon as possible. Third, we want to enhance personal protection. That's why a certain number of KN95 face masks, KN95 masks are included in the packs. If you are going to places with high risk, then you can protect yourself by wearing KN95. Now, on RAT kits, I call upon the public that upon receiving the RAT kits, do use them on a regular basis. I understand that there are a lot of people doing tests with RAT kits every day. Now, I hope that the supply bags would allow families to do more RAT tests. So if you are tested positive, you should report your infection within 24 hours online so that we can grasp the full picture of the infection situation in Hong Kong, as well as providing adequate support, including triage and treatment to patients.
And through this notification platform, the records of the individual, that is an infected and recovered patient, will have formal records. So these formal records will facilitate future use, for example, in vaccination, how to deal with a recovered patient, or how they should apply for sick leave with their employer. And these records can also be used for travel arrangements. So in order to protect yourself and your family, and also to protect overall society and help us stabilize the situation, conducting more frequent RAT tests can help us sift through the cases in our society. So I would like to thank, on 18th of March with Sophia Chan, we held a video conference. We met with more than 100 district leaders and religious leaders. The Secretary for Home Affairs also urged them and their friends to serve as volunteers. So I'll have Secretary Chan elaborate a little bit. I have some photographs. These are the care packages that we will be handing out. I'll have Jack elaborate what's inside these care packages. Secretary Chan. Thank you, CE. The Home Affairs Bureau is undertaking an important task right now, and that is to hand out different anti-epidemic packages. As the CE said a few days ago, the SAR government will take the initiative and work with the community to help distribute the anti-epidemic care packages. The material inside the packages include some resources sent from the central government, and that indicates their support and care for Hong Kong. We have very popular TCM items. We have anti-epidemic resources, including a RAT test kit, KN95 masks, and the SAR made information pamphlets, and also Get Well card. In the last couple of days, Home Affairs Bureau had issued letters to the legislature and more than 400 volunteers, so organizations, district societies, and youth organizations, religious bodies, and so on. And we want to encourage volunteers to help us distribute these care packages. The response is very popular, and there's a high response rate. And as of last night, we received more than 350 organizations positive response, and more than 10,000 volunteers have signed up. So some 58,000 trips have been made so far, and in light of the distribution of work, we will make the suitable human resources deployment. Our plan is by 30th of March, we will start this work, and we will begin with the packaging. We will involve more than 10,000 volunteers and civil servants to do the packing. So millions of these care packages, once they're packaged, they will be distributed to all households in Hong Kong. And starting from early April, throughout 18 districts, our aim is to complete this task within 5 days, and we will be relying on the following channels. First, Housing Authority will be handing out the packages to tenants in Housing Authority estates. For private buildings, we will be working with the Owners Incorporated organizations, property management companies to distribute these materials. And third, we will be relying on the civil servants and volunteers to distribute material to the 3-nil buildings, household by household. And fourth, we will be working with the rural committees and hand out these packages to remote households. So we are very confident that through the above means we can distribute all material to all households. But in order to be safe, we will be setting up different distribution points throughout the 18 districts in Hong Kong to allow people who have not received these packages to collect these packages. On the other hand, Home Affairs is also inducting a material package distribution service. We want to support people who are self-isolating at home, who cannot go out of their homes. So special items such as infant formula, diapers, we will also help distribute these items. So Home Affairs, starting from 14th of March, we have taken up the work from Social Welfare Department, and that is this distribution work. And as of today, we have distributed more than 46,000 of these packages to more than 16,000 households. And for families with urgent needs, we can deliver it the same day. So this service covers all 18 districts in Hong Kong, but because the task is very enormous, we have relied on the support of LCSD, some local organizations, and professional delivery services. So we want to conduct this work as soon as possible. We are also deploying staff from LCSD and Home Affairs. They have formed a special task force. They will serve urgent cases, such as families that are short of food, families that have disabled persons or singletons, elderly singletons. So they will receive these materials in an urgent manner. Thank you, CE. We can now take questions. Please raise your hand, identify your media outlet, and raise your questions. So we'll keep questions to 2 or 3 per person. TVB, I want to ask about the quarantine situation. The usage rate, the occupancy rate is 60-70%, not including the cruise terminal, and the occupancy rate is low. Since we have so many vacant spaces, will you tighten the quarantine rules? Will you require more people to be quarantined? Hospitals can triage some of the mild cases. How do you view this comment? And how many quarantine hotels do we have, and what is the occupancy rate? And the reverse quarantine, what is the situation there? We have occupancies less than 50%, and some might only be some 18% or 2% occupancy rate. So I want to ask, the infected elderly, do they have to be sent back to the temporary centers? Is there some coordination that is not functioning that leads to this situation? Will that lead to more risks in elderly care homes? And the government is offering salaries of $30,000 for retired disciplined forces and mainlanders. So with the infection rates, was there a waste of human resources?
You ask a lot of questions. I will try to answer them all. Some questions about the hardware, that is the facilities we have. Before the beginning of the 5th wave, you may remember that we was in a serious shortage of facilities, including beds for COVID-19 patients, as well as isolation facilities for patients with no or mild symptoms. We only had a Penny Bay and the Lee Yu Moon holiday camp. And at the time, we was in a serious shortage of quarantine facilities for close contacts. In terms of risks, priority was given to infected patients to receive isolation and treatments in isolation facilities. That's why we did not have enough quarantine facilities. And back then, there was no facility for residents from residential care home for the elderly people who was in a stable condition. Because of the lack of manpower and the outbreak in care homes, the residents could not go back to the care home. So those were the challenges that we faced just 2 months ago. With the staunch support from the central government, as well as the efforts made by different sectors, including the private sector, the government, and also the hospital authority, and so on. We have the situation that you mentioned, that is we have more spaces than occupants. That's why that's in line with what Professor Liang Wanlian said. We have to have beds waiting for occupants. Now we already have more than enough medication and vaccination doses Now, we have also achieved the goal of more beds than occupants. Now, from all the facilities, we have 6 isolation facilities, including the largest isolation facility in Yuen Long at Tam Mei, which was commissioned yesterday. Some 60,000 beds are available. Previously, we had a hotel converted to isolation hotels. Now the demand has diminished because of the availability of isolation facilities. Now we can use a hotel for quarantine purposes for those returning to Hong Kong. So that's how we are utilizing our facilities appropriately to meet different demands. Now, if you are just looking at the occupancy rate at a certain point of time, that's not very accurate. If all facilities have an occupancy rate as high as 90% or even full capacity, that means that we are doing a poor job. We don't have a full grasp of the situation right now. As I said, for a family with 2 persons, the supply bags that we are giving them can allow them to do RAT tests every other day. And also we have a triage and multi-tier treatments for patients. That's why we have a spare capacity. If our capacity is full, then we cannot proceed with our work because we would have no place to put the confirmed patients. So we will need enough facilities to meet the different needs. Now, reverted isolation, we only have this arrangement for residents in residential care homes for the elderly people. We don't have that for hotel. In hotels, we only have closed-loop management. We implement this management to prevent staff members from bringing the virus into the community. So hotel staff are making sacrifices. They participate in the closed-loop management. For the reverted isolation that you mentioned, that's for residents in care homes. If we see outbreaks in care homes, we would move the uninfected residents to the 2 isolation facilities. That's the reverted isolation arrangement that you mentioned. Now, in terms of the holding center for elderly people, we have a number of these holding centers. We have 5 of them. Now, we are releasing the places in the cruise terminal by phases. Now, with the holding centers, I'm requesting the Labour and Welfare Bureau to make good use of the spaces for residential care homes to recover. If we allow discharged elderly patients to go straight back to care homes, it would pose a stress on the care homes. According to the mainland experts, we need to continually monitor the health situation of recovered patients. So in order to help care homes to recover, we would put the elderly patients who have recovered in holding centers so that they don't have to go back to the care homes or their homes directly. Rather, they can enjoy medical care in holding centers so that they can continue to recover before going back to the care homes. Now, the $30,000 you mentioned, as far as I know, That's only for hiring carers locally and in the mainland, not medical staff. I have to clarify. The medical team, the medical delegation, some 400-strong delegation sent by the central government receive no pay. They come here on a voluntary basis. Now, the $30,000 is for hiring some 1,000 carers through local agencies. That is for hiring care staff in holding centers and elderly care homes to provide care for the elderly people. So the salary we offered is around $30,000 per month. It's equivalent to the salary offered to mainland carers under the relaxed scheme. I have to clarify, it's not the salary paid to the hundreds of medical staff sent by the central government who are working in the AWE. They are working tirelessly day and night to care for the patients in the AWE, and they came here on a voluntary basis. Well, I'm not sure how much is paid to a retired disciplinary services officers. Now, after a long career, retired colleagues would like to enjoy the retirement life. So I think they are not joining the fight because of the pay. They just want to contribute. So we should not focus on the pay. Thank you. Now, may I remind the reporters, 3 questions at a maximum for each reporter. The reporter over there.
South China Morning Post. So I have 3 questions for you. The first question is on caring for the elderly, because in the latest meeting with Hong Kong government, mainland experts again warned about the low vaccination rate among those aged 70 or above. So looking back, do you think that the government should have adopted much more aggressive measures earlier, such as the vaccine pass? And apart from aiming at increasing the vaccination rate to 90% by the end of next month, is there more to be done? The second question concerns the aviation industry, because it's reported that representatives from 11 airlines wrote to you, urging you to scrap COVID tests for aircrew and learn from the mainland's closed-loop arrangement for the staff. So would you consider the suggestion? Is there any room to, when would you announce more details about the adjusting the route suspension mechanism? And thirdly, for the CE election, the nomination period will start in 9 days. So when will you make up your mind whether to enter the race? And do you think you have a high chance of being the preferred candidate? Are you worried that the government's work would be hindered if the CS or the FS resign from the position? Thank you.
3 questions. First of all, in my various meetings with the mainland experts, this issue of elderly was often raised. This is understandable because of the large number of deaths in the 5th wave of this epidemic. And over 90% of them are old people. And over half of them were old people living in residential care homes. So it is only right for the mainland experts to share more experiences and advice with us. And it is now very obvious and very clear that the one single reason for the high mortality of elderly people in Hong Kong is the low vaccination rate. Because all the facts and statistics locally and worldwide have shown that the COVID-19 vaccine is very effective in preventing critical illness and avoiding deaths. I'm afraid that there could be no looking back. Or what we said, you can say a lot of things with the benefit of hindsight. But if you look at all the press releases, media conferences, appeals and messages and APIs and publicity that the Hong Kong SAR government has done since late February last year when we started the government vaccination program. The focus was always on the elderly. We actually started with the elderly before allowing the younger adults to get the jab, because everywhere in the world they started with the elderly. Because they have already gone through that very painful process of seeing elderly people admitted into hospital, rushing into ICUs, putting on ventilation, and then dying. We have seen it, and we have appealed to the people. So we can only say it is unfortunate for the whole of Hong Kong to miss what we now call the golden opportunity to get the old people vaccinated in time to prevent this tragic incident. And that's why I was very aggrieved and actually very angry when, as recently as a few days ago, a local newspaper was still presenting headlines which were misleading, which will immediately give the old people, their relatives, and the whole community the wrong message of getting Sinovac as to be vaccinated. Yeah. So we all have a responsibility. I'm not shedding my responsibility as a chief executive. I'm shouldering primary responsibility for the fight against the epidemic. But everyone should also bear in mind that Hong Kong is a very free society, a very diverse society, and there are a lot of forces at work to prevent the government from doing what should have been done. In this case, vaccinating our old people. But we will continue to do it. We have set very clear targets to achieve. We are visiting all the elderly homes again for a second and a third time in the coming month in order to get those who have received the first dose to get the second dose, and those who were infected, about 40%, who could not get a jab, then through the second and the third visit, maybe they are then ready to take the vaccination. And I just heard that there are suggestions that we should give old people a choice of doing the BioNTech vaccine, and I have just asked the Secretary for Civil Service to give this the full consideration in order to induce or attract more old people and their family members to allow us to get them vaccinated as soon as possible. Now, the second question about the airlines, yes, I have received a letter from the airlines which the Transport and Housing Bureau is now examining. So we will do what is reasonable, but the prerequisite is we should protect Hong Kong from importation of cases from abroad. Because as you have heard, the World Health Organization, the pandemic is still quite serious in different parts of the world, and we should not let our guard down in order to ensure that Hong Kong could come out of this fifth wave as soon as possible. As for the outstanding issues relating to the lifting of the place-specific flight suspension from the 1st of April, that is the route-specific flight suspension, as well as the availability of designated quarantine hotels. We already have some internal deliberations, and I'm sure that the relevant bureau, I think in this case will be the Food and Health Bureau, will make the necessary announcements as and when they are ready. The third question, I have no answer for you except to reiterate, and according to the laws of Hong Kong, the nomination period for the next term chief executive election will still be the 3rd of April. Thank you.
第三位記者嘅提問。
The first question is about that the government is looking at vaccination for patients at homes who are mentally incapacitated. So if these patients have side effects, then who will bear the responsibility? Will the medical officers be responsible? And are you also worried that family members will raise legal challenges? Now, we have the oral medication for COVID, and it is believed that the early use of medication is beneficial. So will the government expand the range of medication? So your first question proves what I said earlier, that even though the world agrees that we need to reduce the number of deaths among elderly and we have to rely on vaccination, but in Hong Kong, everything is controversial. So even when doctors have assessed the elderly and deemed suitable, they cannot be vaccinated because the family members object. This is the reality that we are observing, and it is very perplexing for us. So I don't have any further notice regarding legal measures and therefore cannot respond to your hypothetical question. But thank you for raising the question anyway, because it reflects the vaccination issue in Hong Kong. It leads to a lot of controversy, whether it is political or legal challenges. The application of oral medication, as I mentioned many times, we are assisting the hospital authority. We've procured a sufficient number of medication. So regarding the use, we can be more generous and we can reduce the number of serious cases and deaths. And the best effect of medication is at the early stages of infection. So when it's administered, it should be administered widely. So at the first layer of contact amongst the elderlies, we should be applying this oral medication to prevent them from developing into serious cases. And the hospital authority is applying it widely, including in hospitals, in AWE, in the community centers, and also in designated clinics, and the hospital authority outreach programs. The private hospitals, if they cooperate with us, and we are willing to allow them to use this medication. So similarly, if private doctors, when they treat COVID patients, there's no reason to not allow them to use the medication. But as far as I know, the private clinic doctors, when they have COVID patients, they are referred to the hospital authority.
If private doctors are willing to treat COVID patients, then in order to protect the patients, especially the elderly people, we will surely welcome a prescription of these two oral medications. Next question, the lady in the front. Hi, I'm from News. Now, the situation is still very serious, and there are lots of invisible patients in the community. If we are to send 10,000 volunteers to go door to door, how can we enhance the protection for these workers so that they can continue to serve the community healthily? The situation right now is still very serious. Now, every day for PCR and RAT, we have some 10,000 to 14,000 people infected every day. So we have to consider whether an activity would lead to infection risk. At the same time, the delivery of anti-epidemic service bags is meaningful in terms of guarding against the virus. So we have to strike a good balance between the two considerations. On one hand, we have to distribute the service bags to all families in Hong Kong so that they can have better protection and so that they can do more RAT to allow the government has a better grasp of the situation, and also for us to arrange for treatment when they are infected. On the other hand, we need to mobilize human resources to distribute the service bags. Please be assured, the Home Affairs Department has made arrangements in terms of packaging of the service bags by volunteers or the delivery of the service bags. Each volunteer will be provided with adequate PPE. During the course of delivery, the volunteers will be reminded to be careful. So like Mr. Jack Chen said, in public estates or private housing estates, we would not deliver the service bags door to door. We would just simply give the service bags to the property management offices so that residents can get the service bags themselves. So for delivery door to door, we would be talking about 3 new buildings without property management. Those are the buildings where volunteers will go door to door to deliver the service bags. Adequate PPE will be provided. Next question. The gentleman in brown. Chief Executive, Mr. Jack Chan, good morning, Phoenix TV. Now, besides delivery door to door, the service bags will be distributed at distribution points. So how many distribution points will we have? Do members of the public need to register for that? And also, is it a one-off operation? In the future, would you consider distributing more service bags? Now, we have seen more discharged patients recently. However, for a few days, the mortality rate has risen. Now, have you assessed the effectiveness of the hospital's work? Did the mainland medical experts give us any recommendations, and will the government adopt them? Now, I will invite the acting secretary to talk about the distribution points and the registration arrangements. Thank you, Chief Executive, and thank you for your question. Now, the workflow is, as I've mentioned, first, packaging. In Hong Kong, we have more than 100 packaging points in school premises, community halls, and sports venues. In terms of distribution, property management companies and the housing authority would deliver the bags door to door. To play safe, we will keep some distribution points running. However, it depends on the situation. Through the property management offices and volunteers, if nearly all families receive bags, then we may not need so many distribution points. However, if there are a lot of households which did not answer the door, then we may need more distribution points. And these points may not necessarily be in schools or sports centers. They may be on the street. So we will keep all options open. For registration, there will be simple registration required. We trust members of the public. However, we still think a simple registration is needed. Thank you, Chief Executive. Now, at present, the distribution of anti-epidemic service bags is a one-off operation. Of course, we can have many one-off operations. So depending on the development of the epidemic, if we can ensure a stable supply of medical supplies, and if it is helpful, of course, we will consider it. You mentioned the mortality rates of elderly people in this wave and the mainland experts' recommendation. I can give you a detailed reply. For elderly people, I mean, the calculation of the fatal cases, our experts considered it necessary to analyze the approach again. Like Dr. David Hui said, maybe it is probable that most of the cases are not related to COVID, so we have to do the analysis. That's also the view of the mainland experts. Every day we are reporting the fatal cases, but we should announce the clinical details of each and every case. So that's the analysis that we will do. But that's not for maneuvering the number. We want to give a clear account to the Hong Kong society and the actual mortality situation. To reduce the severe and death cases, we have received a lot of useful recommendations from the experts. Now, most of the recommendations are being implemented. To achieve the goal of reduction of severe and death cases, there are 4 focuses according to the mainland experts. That is to focus the patients, our resources, the treatment, and the manpower. We should not disperse the resources. So earlier this month, the hospital authority has redeployed its resources to achieve the focus. More than 10,000 patients are receiving concentrated treatments in hospitals, including Queen Elizabeth Hospital, which has been converted to a COVID dedicated hospital. So that's the strategy of focus, which we have implemented. The second strategy is the 3 priorities. We will prioritize on priority groups, institutions, and places, including care homes for elderly people and also elderly people at home. Elderly people are the group which we prioritize, and also we have different care homes, have subvented or not.
If we have disabled elderly or single elderly, we have to pay special attention to them. So I mentioned we have temporary shelters for elderly. We also strengthened our support for elderly at home. If they need to go to designated clinics, we have a special quota for them. And as we said earlier, we have more beds than patients, and the quota is also larger than patients. This is important because we need to expand our capacity in anticipation of increased cases. And at the early stage, we had shortages. There were lags. Some people couldn't receive service. Some people's infection worsened. And so these 3 priorities, plus 1 priority, that is everything related to elderly services, they should be given the highest priority. So when can we see the implementation of these policies plus the 2 new oral medications? When can we see the deaths coming down? We'll leave that to the experts. So hopefully through all these efforts, we can see the number of deaths coming down, and we also need to prevent the elderly from serious consequences and they need to recover soon as possible and return back to their homes or return to elderly homes. Let's take the last 3 questions. Regarding the care packages, just now Secretary Chan said that there might be simple registration if they collect it at collection points. So they have to register in advance, or do they register at the collection point? Are they registering as an individual or a household? And how many items are there in the package? For public estates and private buildings, how will property management companies handle the packages? CE said that the nomination will proceed as scheduled, and we now have rumors that the Chief Secretary and Finance Secretary will resign. Have you received their resignation notice, and will the CE, will you also run in the upcoming elections? And you also mentioned that China Construction, if there are any problems arising out of their work, you will intervene. So we also have 11 airline companies, and they say that their work has been interrupted by the government policies. So will you take their suggestions? Cable news. First, the care package is widely distributed to Hong Kong households. So when we take the initiative, we don't need registration as long as they have a home, whether it is a village house, public housing estate, private housing, and so on. So it's not like post office mail delivery where if they cannot deliver it, they will be left with a card. They will be told they can collect it at a collection point. So these are the details. It will be convenient. If it's going to be a wide distribution, we don't need to be so hung up about the details. So that leads to the other question about what's included. I thought Jack Chan already told you there are 5 items. First, TCM. It's very popular. We have 2 boxes of mainland. We have the special medication targeting COVID, and we also have the RAT. We have 20 test kits, KN95 face masks, 20 of them. And then we have information pamphlets from Center of Health Protection. We have some guidelines and pamphlets. And we also have a Get Well Soon card. So this care package, it will be delivered to households. So we have 20 kits and 20 masks. So a typical household in Hong Kong has 2 to 3 people, so it should be sufficient. So if some families say, well, I have 7, 8 people in my household, so our volunteers can have some discretion. They can hand out an extra package. So even with our mandatory testing, all the households just collected 1 package. So that's how it worked out. So it's our token of appreciation. It's also resources from the central government. So we won't be applying strict registration. That's not the approach. And I won't answer your question about the CE election. but I can clarify facts. I have not received any resignation notice from any secretary. If I've received such notice, I have to report to the central government, and I have to also notify the public. Third, I think you were referring to yesterday, China Construction International. We requested the central government to designate them because a lot of work done in the past, they performed well, and the central government accepted our request and designated this company. So they provide a lot of support on the mainland. So when 7,000 construction workers work in Hong Kong sites, there are another 7,000 doing prefabricated parts. So given such an urgent scenario, we want to build our facilities, and this is China speed. Starting from 1st of March, our first Qingyi community quarantine center, and till 24th of March yesterday, we received our sixth 20,000 bed facility. So this is China speed, and it's also a record for Hong Kong construction records. I've never seen something so fast. And yesterday, we mentioned that Secretary for Development issued a press release that is, given the COVID situation, a lot of government contractors were affected. That is, they cannot start work, or a lot of workers were quarantined or isolated. They can't go to work, so that affected government works. So the press release said that we will apply a more relaxed approach. We have completion date for projects, and if they can't complete the project, there will be some penalties. So we have facilities being built in Kai Tak and Penny's Bay. So these contractors are affected because they've deployed more than 10,000 workers from the different sites to these 6 quarantine facilities. So a reasonable construction procurement approach is to apply discretion. So they won't be given extra merit. So our tender system is open, transparent, and fair. We're talking about works being done today, and it is affected by COVID, and we have a large redeployment of staff to help us build the 8 quarantine facilities. So the reasonable approach is to handle it appropriately.
So the letter has been passed on to the Transport and Housing Bureau for consideration. So after considering the letter, we will announce any adjustments. I have to stress that the restriction of arrival is to guard against importation of infection. We will not abandon this strategy. Otherwise, we will never see the reopening of cross-boundary travel with the mainland and with overseas. So I always say we have to chart our own road in this fight against the epidemic. We will continue to improve our work with the hope to stabilize the epidemic. Thank you. Now it is 12 o'clock. This is the end of the media briefing. See you tomorrow at 11 a.m.